This segment is sponsored by Trinity Health. October is Breast Cancer Awareness Month, and we hear a lot about mammograms during this time. But what are some other breast health related services available to our community? Well, Stacey Newmyer is here. She is a nurse navigator with Trinity Health Breast Center, and she's going to share some of those services with us. It's good to see you, Stacey.
Good to see you. Thanks for having me.
Oh, I'm glad to. Because mammograms are so very important, will you review for us what the current screening recommendations are?
You bet. So, our experts recommend an annual mammogram for all women over the age of 40, and then for sure, always doing monthly self exams as well.
Now, what is the 3D mammogram that I hear about?
So 3D mammograms are what they also called are tomosynthesis, and they are designed for women, especially with dense breast tissue, um, versus the 2D, which we've all probably had if we're over the age of 40. The 3D tend to take more pictures of the breast tissue in a different fashion. So it allows our radiologists to see through that dense breast tissue and at different views as well.
Hmm. What is an abbreviated breast MRI?
Abbreviated breast MRIs are additional screening. It is used for increased accuracy when performed with annual mammograms, especially again with women with dense breasts. It is used to detect invasive breast cancers, and usually the exam, being that it's abbreviated, takes about 30 to 40 minutes. So it is a great tool to have.
Hmm. You have something called a high risk clinic. What is that?
High risk clinic is here at our comprehensive breast center. The patients are identified as high risk by what's called a Mammo Plus. So that's either through a Trinity Health location or through another program. Patients at high risk do tend to have a significant family history of breast cancer. Patients at high risk also can be current non malignant. Patients that have breast disease that puts them at a high risk, such as atypia that has been found maybe in the breast cells, or what's called lobular carcinoma in situ. Patients who have recently finished treatment for breast cancer as well. We do have a Risk Plus program that offers custom surveillance for these
Hmm.
patients who want more of a watchful eye.
Peace of mind, I'm sure. Now,
Yeah.
I introduced you as a nurse navigator. What is your role in the journey?
So, as a nurse navigator, we really walk this journey with all of our breast patients, from diagnosis all the way through their treatment, every step of the way. So, we introduce them to our surgeons, our oncologists, both medical and radiation. We're here to really be their advocate and just educate them every step of the way, making sure that nothing falls through the cracks as far as appointments go in their care, just to really be a support. And then also, be there for questions or concerns that the patient has. So they do have a point person through that whole journey until survivorship. And then we often always tell our patients, even through after survivorship, we're here for you. Feel free anytime to reach out. We're happy to help. And that involves Candy and I both here at the Comprehensive Breast Center in Muskegon for Trinity Health.
Nice, your partner there. Well, thank you so much for the information. We want to let folks know that they can learn more about the Trinity Health Breast Centers by visiting trinityhealthmichigan.org, or you can call the location nearest you in Grand Haven, Grand Rapids, and Norton Shores, and we'll put all that information on our website at 13onyourside.com. Stacey, thank you so much for spending some time with us.
Thank you so much. I appreciate it.